there is a lot of uncertainty right now about dealing with COVID-19 and how the healthcare system is going to change.
Yeah, here now to explain some of those changes and other topics concerning coronavirus is Dr. Oz with us. He's actually live in studio. Nice to have you here today. Nice to be able to talk to you without a delay. Also, good to see you. Thanks for coming.
It's my first visit to a studio in 3 months. I've been locked in my basement, as you know, so it's good to be here.
Well, you're the first guest that we've had live here as well, so glad to have you. You actually, though, yesterday you went to the meat packaging facility in Logan. I think we've got that picture. And so what brought you there? Why did you decide to go there and take your social distance at JBS right there?
Right. Well, you see, I'm far away from where the epicenter in the country is. I was there for, we have some show partnerships up in the Cache Valley, so I was visiting them. But when I was going there, I was reading in the New York Times that it was the epicenter of the country for COVID-19. And it reminded me to emphasize to everybody that we can get these outbreaks anywhere. Meatpacking facilities tend to be prone to outbreaks because folks come from outside the community. They'll work there. They are in close proximity. They often are working face to face by the nature of how these processing plants work. And we need these processing plants. You know, the American meat supply actually has been compromised significantly. And we've been working on trying to figure out how to connect all the dots of this. But that's what the facility looks like. You see, it's bucolic. It's a pretty area in the Cache Valley. You wouldn't think anything of it looking outside this, and your firm could easily be hit as well. So if we're not careful about doing the important things correct, which most importantly, wearing face masks or socially distancing, which is what we're doing here, and washing your hands if you, no matter what, frankly, but especially if you can't do those things, then we'll be in trouble. And in hospitals like mine, New York Presbyterian, we've been able to keep the COVID-19 patients from infecting the rest of the population by doing those three simple things. They work. We just have to make sure we create work environments where it's possible. Then we'll all be safe. We don't have to have a problem with the reopening.
Okay, so Dr. Oz, we are learning so much, it seems like, and it's over time. We're figuring these things out. So what else have we learned about our healthcare system, and how is it going to change because of all this in COVID-19?
Well, I have an op-ed coming out in Forbes tomorrow, and I'm going to tackle this. And most people don't realize this, but I actually went to business school because I was interested in healthcare finance. And I have been, for most of my career, curious about why we have not shifted how we deliver healthcare finance. And here's the problem. When you have COVID-19 breakout and hospitals have to stop taking elective cases, they also stop taking money. And in America, we get paid based on what services we provide to patients. So if we're not doing heart surgery because we're worried about COVID-19 patients, then those hospitals start ending in with financial difficulties. And our healthcare system is in dire straits, with many hospitals not having brought in revenue for the last 2 or 3 months, on the verge of bankruptcy. And even the systems that, like mine, New York Presbyterian, that had lots of patients with COVID-19, we're not doing the cases that we normally would do. And those hospitals, like mine, haven't been able to bounce back fully because people are reluctant to engage the healthcare system. So I'm arguing that we need to take a system that works. Medicare for all is not the way to go because it's not fundable, but Medicare Advantage for all could work. And Medicare Advantage is, as most seniors know, is a very successful program. About 1/3 of older Americans have it. It's not new to the world. Many countries in Europe use a program like this. And we could use a mechanism that already exists, like Medicare Advantage, allow our hospital systems to get regular revenue by preventing illness, not just because they're treating sickness, and it would be affordable to businesses. And we shouldn't waste this crisis. It's a change that needs to happen. We've been fighting back and forth on this for decades. Let's make this the opportunity to also address the inequality of health that's delivered across different socioeconomic spectrums. Because if we have a program like this that works for affluent folks, it could easily be expanded to folks who don't have as much and cover everybody.
Well, I think there are a lot of changes, a lot of things that we're learning right now as a nation, as a world, really. And one of those things, you know, there's metamorphosis really in our country, especially with all the protests going on. And a lot of people have wondered if we're going to have so many new cases spiking because of these protests, people in close proximity to one another in huge groups. Do you think that that's going to lead to something worse right now with the coronavirus, all these protests, I should say?
But we're going to have more cases. It's almost impossible that we wouldn't. We're literally violating every recommendation with these protests. That stated, most of these folks are young and healthy, and so the side effects of getting COVID-19, although we don't want to have anybody get the illness, generally will be well tolerated. 95% of people who get admitted to the hospital with COVID-19 are diabetic, hypertensive, or overweight or chronic lung issues. So they have chronic problems that we haven't prevented with our healthcare system, but they're the ones that get admitted. So most of the protesters, I don't think, will be ill enough that that it'll cause a major burden to the healthcare system or to their lives. However, I don't want them visiting their relatives, and I think anybody who's protested at least once ought to get tested for COVID-19 within a week of protesting, and they definitely shouldn't visit folks who are vulnerable, because that's how we would create another resurgence of COVID-19, and we don't want that. Just when we're coming out of this, we can get the opening of America to be a successful opening like has occurred elsewhere around the world if we don't muck it up and we don't throw away all the wonderful work we did to get here.
Okay, so Dr. Oz, where do we stand on a vaccine and how quickly these vaccines have been developed? Do you think that will hinder people from getting them because they think, wait, I'm not sure if these are safe, I want to wait and see?
Well, you make an excellent point, and so do a lot of people who are concerned that normally it takes 4 years to make a vaccine. That's the fastest it's been done. That was the mumps vaccine. And we haven't gotten even close to that with other vaccines. It takes years to develop these tools. However, every single major company is using every tool at its disposal to make vaccines. We're accelerating, using many different tactics that the government is supporting to make a vaccine available to the world, and certainly the members of this country, by the first quarter of 2021. I think we'll be there. I think the vaccine will be safe. It will not be released if it's not. But I am respectful of people who are resistant. And I know that a good part of the population will not get vaccinated because they're going to have concerns. They're going to harbor concerns no matter what we say.
Let's talk about the disparity in COVID-19. Why is there such disparity between minorities and other groups with COVID-19, do you think?
Well, those chronic illnesses that I've mentioned result in most people who go to the hospital needing to be hospitalized with COVID-19. They exist a lot more frequently in minority populations and folks who are in the lower side of the socioeconomic spectrum for a bunch of reasons. They don't get appropriate care. They don't have access to care. Sometimes a knowledge issue. Being healthy does cost a little more oftentimes to buy healthier food and be able to go to your physical activities. Plus the stress of being on the poor. You don't have time to take care of yourself, you think. On the other hand, when you have these kinds of chronic illnesses ravaging minority populations and COVID-19 comes in, it's an extra 1-2 punch. And the mortality rate, the hit on African-American populations, for example, with COVID-19 is probably twice that of white populations. So it's a big difference that's now being manifest when a chronic illness is added to the COVID-19 burden.
Dr. Oz, before we let you go, let me ask you one final question. Do you think, since you visited Cache County, you say it's the epicenter now of COVID cases, I know Arizona is also having a tough time. Do you think we'll see any states actually go backwards and go back to lockdown because of these COVID outbreaks, or do you think it's necessary to keep moving forward and just protect the vulnerable populations?
I think your latter approach is the one that most states are going to adopt. It'd be difficult for me to imagine states shutting down. We tried it, we did it. I think most people are realizing that now we know more about the virus. There are lots of things we can do within our companies as individuals to be able to draw circles around COVID-19 outbreaks. These brush fires are going to happen. They're going to continue to happen until we have a vaccine. And we're going to have to get smart about how to stop them down before they spread more widely. So the number of people impacted is minimal. We're also getting better at treating people who get COVID-19. So I'm hoping the combination of better results with people who do get hospitalized and a more aggressive testing and screening system to prevent spread of the virus will allow us to avoid the kinds of risks we took in February when we didn't know that much about the virus.
Well, Dr. Oz, thanks for being our first in-studio guest since March as well. And thanks for coming out of your basement to the next tier, which is our studio. Hopefully it was an improvement.
It is a big step up. It's my birthday tomorrow, so my birthday present was getting out of my house.
So good. Finally.
Happy early birthday, Dr. Oz. Thanks for spending it with us, sort of.
Yeah. God bless you both.
Likewise, thank you.
Oh, before I forget, I'm sorry.
Yes.
I actually came here for a different reason. We're doing a big program, as you know, trying to feed kids in America. And Kids Eat is a wonderful foundation. 1 in 7 kids in this area are food insecure. And so please, if you've got the ability, try to support some of these kids. KidsEat.org is the website. Wonderful organization that's putting food in kids' backpacks. And especially at a time when they don't have food from their schools, they need our help. Please chip in.
That's good work.